Good afternoon. I'm Dr. Stephen Farrell, the Chief Medical Officer at Forest General Hospital. I want to welcome y'all this afternoon to an announcement of joint efforts between Forest General Hospital and Hattiesburg Clinic in our efforts to combat the healthcare crisis in our community and how we are responding. I'd like to introduce Dr. Brian Batson, who is the board member of Hattiesburg Clinic and is letting up our efforts in the COVID illness arena, and he will make further announcements at this time.
Thank you for coming. I have a written statement that I will be reading. Over the last few weeks, our community has been enormously affected by the novel coronavirus, or COVID-19. As healthcare leaders, Forest General Hospital and Hattiesburg Clinic understand the critical nature of stopping the spread of the coronavirus. Reducing the number of symptomatic patients who go to a primary care or urgent care facility or go to the emergency room will be a major step in reducing the spread of the virus and sustaining our healthcare network. With that as background, Forest General Hospital and Hattiesburg Clinic will be opening the Cough and Fever Clinic. Effective Wednesday, March 18th, the Cloverleaf Immediate Care Facility, located at 5909 Highway 49 South, adjacent to Walmart, will be converted to a clinic to assess patients with cough, fever, and other respiratory symptoms. This is a walk-in clinic, and it will be open from 8 a.m. to 6 p.m., 7 days a week, and staffed by physicians. We're asking that if individuals have questions about their symptoms, they should call their primary care provider first. It is important, in order for us to help contain this virus, that if people do not have these symptoms, they continue to use their current healthcare providers for care. Patients will be triaged and evaluated, and COVID testing will be done when appropriate based on clinical criteria and guidance from the CDC and Mississippi Department of Health. It is open to all patients, regardless of age or pre-existing medical conditions, and regardless of their ability to pay. As patients are triaged, they may be asked to wait in their car until an exam room is available. Hattiesburg Clinic dialysis and endocrinology patients, as well as patients who are presently getting services at cardiac rehab, should continue to receive their care, and measures have been taken to ensure the safety of all patients and staff. This is not a drive-through clinic. All patients will be assessed by medical staff and screened to determine what testing is appropriate. We continue to evaluate options for drive-through clinic as testing supplies become more readily available. Please understand that this situation continues to evolve rapidly, and alterations to this plan may occur in the future. Additionally, please try to be patient as medical offices are doing their best to handle all phone calls as they come in. I want to thank Forest Health and Hattiesburg Clinic leadership for organizing this effort as we all work together to try to reduce the threat of this virus.
We'll now open to any questions that you may have.
Have y'all seen a dramatic rise in the number of people being tested for coronavirus?
Yes. So allow me to editorialize for just a moment. This is really a big deal. To come together in a short period of time to get this accomplished really highlights the coming together of our community's medical resources, with Forest General Hospital and the Hattiesburg Clinic meeting over the weekend. And really the State Department of Health has been instrumental in giving us the resources to be able to do this. They've set us up as a center of excellence, if you will, such that we get enhanced access to testing. They'll pick up our lab tests here. They'll expedite orders to us through a web portal. We couldn't have done it without them.
How do you respond to the people in the community who are saying that this is no worse than the flu? This is all a big media hype. What's your response to those people out there? How would you like to address people in the community who are listening to those people?
It's a really good question, and there's good reason to think of this as like the flu, because it is an upper respiratory illness, but it is far more severe than the typical influenza infections that we've had. Its sister illnesses are the SARS coronavirus, the MERS coronavirus. These things were much, much more severe, and thus far it's borne out. Although the younger people are not having the mortality rate that is associated with some of those other illnesses, once you get above the age of 60, this illness is very, very severe. Many of these patients are having to require hospitalization, ventilation, and that's where the shortage really lies around the world. So this is a much more severe illness than your typical influenza. I can tell you firsthand from the patients we've seen.
I saw this morning that they're now recommending no more than 50 people in social gatherings. Can you talk about that now?
This whole game is designed towards leveling the curve of cases long enough to allow medical personnel to be able to meet the demand. If we can hold off on cases that come in through the community long enough to get resources like this built up, we'll be in a better position when this virus comes back, possibly in the fall, when it comes back for sure next year. So if we can level off community spread by keeping gatherings as small as possible, we'll have less cases, which will allow us to have more ICU beds, allow more ventilators, and more people to survive.
Taking notes of that question, you reference coming back. Is there a possibility that this will recirculate?
Yes. This virus will definitely be a human virus from here on out. Humans will get this infection now for as long as we're alive. Hopefully we'll have a vaccine that will, level that curve like we do with influenza. But if we didn't have a flu vaccine, this same thing would happen every year with the influenza infection.
What are you hearing about a vaccine? Are they getting closer? What are they telling you?
Well, if you've watched Seinfeld, I'd say wheels are in motion. Wheels are in motion. They're working on it.
So what will procedures at the clinic be like? What will you do?
So most patients who come in with these symptoms, and I'm speaking based on what we've done in the last few days in other clinics that are seeing patients who present with these symptoms, you want to eliminate other causes of these symptoms, such as strep throat or mycoplasma walking pneumonia, or even the flu, as Dr. Rubash said. So part of this triage process is to evaluate for those other causes of fever and cough, and to ensure that the patient does not have one of those as well. So it's a stepwise process to evaluate the patients looking for other causes of flu and these same symptoms, and moving on from there based on a medical evaluation.
So it's still called before you show up, right?
Not to this clinic.
Okay.
This is a walk-in clinic. To your regular providers, yes, and they will possibly direct you to this clinic. So this is an example of team-based care. So because we have this clinic opening up here, when people call my clinic and they're being seen for heart failure or COPD or whatever else, I don't have to worry about intermingling them with patients that are worried about this illness. So I can say, come over to the cough and fever clinic and then come to see me for diabetes and heart failure and all those other things.
But they still need to stay in the car and they walk in.
Not necessarily. They need to check in, and of course, if there's no one in the waiting room or the waiting room is small and we're able to appropriately distance the patients from each other, they may be allowed to come inside. Right now, we don't know how many patients will need this service. I mentioned the waiting in the car for the possibility that the clinic does have a significant number of people that need to be in a waiting room. We would not want them closer than the recommended distance to each other, and we would ask them to wait in their car while the next exam rooms become available.
How long do you predict lines will be? How long could a person end up waiting in their car for care?
It is impossible to tell at this point. We have staff, we've prepared for a lot of patients, and we can staff up additionally if we need those.
Is the state of emergency what made this possible? Is that the resources that made this possible?
It's beyond my knowledge of the machinations of government to answer that with any sort of intelligent answer. But I do know that if the State Department of Health didn't give us these additional resources, we would not have been able to pull this off. It wouldn't have made any sense if we couldn't get testing done in an expedited manner.
How long will it take to have someone tested when they come in here and if it's determined that they would need to be tested? When we all have those results back?
Great question. The experience over the last few days has been that it can take up to an hour to eliminate the other causes of flu and cough. If a patient is tested for COVID, those results can be available within 24 to 48 hours, depending on the lab that those are sent to. Because the State Department of Health is receiving samples from all over the state, we can't necessarily guarantee that. And sometimes samples may need to be sent to other labs as well, which may take longer as other labs are getting ramped up.
Are there going to be local labs that ramp up to test this here in the Hattiesburg area?
I don't know the answer to that question. I know there's conversation about that.
I think at the present time, we're trying to investigate if we can add that capacity. It's very difficult given the kind of technology that needs to be very specific for these lab tests.
When you look at Mississippi as a whole, are we better off than most states right now? What would you say?
Well, I mean, you can look at those CDC maps, and we don't have a lot of cases compared to some other states. 10 as of this moment, and that could be old by the time I get done with the sentence. But relatively speaking, yeah, we've been spared. We've had the benefit of seeing what's happened in our other states, and hopefully we can learn from that and have a better response.
And equally important to continuing that status is everyone doing what they can do to prevent the spread. So yes, as Dr. Rubash said, we've been fortunate thus far, but we don't need to let that be an indication that we need to not take this seriously, because we all have a responsibility to prevent the spread of this.
Would it help you guys to close schools down? Do you think that we need to get to that point?
Complicated question. There's ramifications associated with school closure that go beyond just the medical decision making. By and large, if we can avoid close interactions with one another, we're going to be better off from the number of cases seen. But every decision has consequences down the road. And that is a complicated question for which I don't have a 10-second answer.
How are you maintaining the hygiene within the clinic?
So all staff are trained on the appropriate use of technique. And again, those recommendations are changing very rapidly as well, based not only on us learning more about the virus, but also recognizing the shortage of healthcare providers that could ensue if we're not taking appropriate techniques. So all staff are trained appropriately on those sterilization techniques. For patients who are being seen in this facility in endocrinology, those entrances between this clinic and those clinics are being sealed off, and all the staff are trained and monitored to make sure they're adhering to the guidelines.
And just one more. Do people need to have insurance? If they don't have insurance, how would that work?
No patients will be turned away regardless of their ability to pay.
What are as people ask, what would the cost be if you didn't have insurance?
We have no idea on how to answer that question now, because we don't honestly know how much the testing costs for some of these things. So the important thing is that we try to provide the service to the community and make sure that we're doing everything we can to squelch this as best we can in our community.
Do you know if other areas in Mississippi are opening similar clinics? Have you guys?
I think Dr. Dobbs is looking at this as being a model of what's to come, which is probably one of the reasons why he partnered with us to help get this going. If this functions well in our community, we're hoping it can be replicated in other places.
Okay. If there are no more questions, we want to thank you very much again. We look forward to working towards a good outcome here. Thank you. Good job, guys.